Periodontal disease is generally starts out as gingivitis, which is actually an inflammation of the gums. A lot of patients experience this by bleeding when they brush, or they try to floss and it's very painful because of the amount of bleeding and sensitivity that they have, the inflammation that they have in the gums, and so they don't floss because of that, and that just leads to a worse case of gingivitis, which eventually will irritate the bone enough that the bone starts to resorb around the teeth. And so once bone loss starts to happen, that's when it turns into periodontal disease. There are different stages of periodontal disease. Early on, you can't even see it in the x-ray. You just see it during your probing depths when you go for your standard cleaning. Later stage of periodontal disease, you actually have tooth mobility. So if a patient's biting down and they say they just can't bite down on some teeth, it feels like their teeth are moving, there's a very good chance that that patient has periodontal disease, which is the bone loss around teeth, so they lose all that supporting structure. So even though the tooth may be fine, the bone and tissue around the tooth is not fine, and it's losing that structure, that support to hold the tooth in. With severe periodontal disease, you need to get maintenance immediately. A lot of patients end up going to their dentist every 3 to 4 months for regular care and deep cleaning, scaling, and root planing. All this is very good to arrest the disease, so to stop the disease, but it doesn't always work. Sometimes it progresses, sometimes it continues to get worse, and at that point, that's when a good time to start looking into other options. With implant options, that's a great option because you're able to remove the teeth, which removes the disease, and then you're able to place implants and have teeth in an area that you couldn't have teeth before. Teeth, it's the teeth that are the source of the infection. So a bacteria is able to harbor between the teeth and in the bone. It makes the bone pull away from the teeth. So once the source of that infection is out, once the teeth are out, once that bone is able to get cleared, there's no more place for the bacteria to harbor. There's no little holes, little areas for it to hide. So once we're able to clear all that out, then you're able to get implants and don't have to worry about that periodontal disease affecting that.